The sections in this chapter will provide you with a roadmap to understanding the types of treatments and interventions that are available to help your child to learn and grow and be his or her best, no matter what age he or she was diagnosed.
Knowing how to set up a treatment plan or a treatment program is something that is completely new to parents, and it's something that parents learn over time. And one thing that can be helpful is to keep in mind that you are developing a partnership with the professionals working with your child.
Our job as parent is to parent our child, and we're not skilled behavior analysts or therapists. Some of these strategies don't come natural to us. They're not part of our parenting menu. So we have to do our best to collaborate with the professionals working with our child when it comes to specific therapeutic interventions. The best thing is we know our child best. We know our kid. And for that reason, in collaboration with these therapists, we can create a very successful and empowering situation for the child and for the family.
So the goal of intervening, of treatment for kids on the autism spectrum, is so that kids can be more adaptable in life, so that they can become more independent, so that they're able to function and get used to kind of what the world is like outside of either their home environment or the world that they're used to.
There are so many interventions that are listed as working towards improving autism or treating autism. And that gets very complicated as a parent. How do you manage this? How do you make sense of all these different interventions that are out there? Well, there are a number of interventions that we know are successful and that seem to be effective for most kids with autism. Now, no one particular intervention is effective for all kids with autism, but there are a number that are effective for most kids. The most empirically supported treatment that's out there is treatment based on applied behavioral analysis, or ABA-based treatments. And there's a number of different ABA-based treatments that are out there. They have different names, but they're addressing the symptoms and the behaviors of autism using behaviorally based principles.
There are also other types of therapies and treatments that are often helpful for children with autism, including speech and language therapy, occupational therapy, physical therapy, sometimes social skills groups, and a variety of other therapies and treatments.
And there's a host of other treatments that are out there. With these other treatments for whom we don't know what the empirical support is, they just haven't been evaluated enough, we want to try them cautiously. We want to first make sure that any intervention is sensible. Does it make sense? Does it sound like it could be helpful for your child? We want to make sure it's safe. If there's evidence that it could be harmful, we're going to steer clear of that one. We want to make sure it's not using up all our resources, right? We have finite resources. We want to use those appropriately, and we want to err on the side of investing in treatments that we know are going to be most effective. And really, we want to use treatments that we can do easily within the context of our family. If we're engaging in a treatment that's just causing all sorts of stress for everyone else in the family, we really want to steer clear of those sorts of interventions that are causing greater distress for the family than actual benefit.
When wanting to bring out the best in your child and make them more able, we want to try and stick with treatments that have a better track record and are not such a big drain on our pocketbook.
For the most part, by definition, autism is a diagnosis that requires a fair amount of intensity. And certainly there are exceptions to that, but I would say more often than not, we're aiming for something that is fairly intense. And the definition of that is usually some amount of therapeutic services or kind of therapeutic or constructive learning opportunities every day. The other thing that's really important besides the intensity is the kind of the comprehensiveness and the coordination. Usually at the core of that will be the parent, the person who's really kind of pulling all those things together. And I think it's important for the parents to have some trusted providers that they can be working with in doing that. So when we're thinking about the components of intervention, I think of that as being a picture that involves multiple different services, and usually those services occur in pretty different domains. For example, we have school district services, and the majority of kids with autism are going to be receiving special education through their public school district, and they'll have certain services that are written into that program. They might have speech therapy, or they might have occupational therapy or behavior therapy. Another component that's very common that more kids than not are going to have who have a diagnosis of autism will be speech therapy. And usually what kids are getting at school is enough to assist them with their language needs in the classroom, but it may not be the ideal amount of speech therapy that a child needs to make the progress that the parents want to see. The same thing would be true for occupational therapy. That would be another separate domain. And kids might have occupational therapy for some associated features of autism that go along with autism. So things like fine motor skill deficits, deficits in their self-help skills, things like getting dressed or using utensils for feeding, that kind of thing. And oftentimes in the field of autism, kids will have occupational therapy to address their sensory issues. There are other therapies that I would, say are important on maybe a more individualized basis, things like social skills interventions, participating in social skills therapy groups. And then a big one in autism is applied behavior analysis, which is a whole separate piece that actually is in and of itself a comprehensive intervention program, but oftentimes sort of goes along with these other components.
We use ABA, Applied Behavior Analysis, to teach new skills. So new skills that our children need to learn that are not in their repertoire. They're not in the current set of skills that they can do. The second thing is that we then want to make sure that those skills that we teach are generalized to a larger setting.
We do have in autism a significant problem with generalization of skills. And so we've got to then be able to move kids from I can do the skill that I've learned in therapy to I can do the skill that I've learned in therapy anywhere. There are ABA programs that are highly structured, and there are ABA programs that are much more naturalistic and sort of play-based. So some of the characteristics in kids that I think about that are useful for sort of matching them to the appropriate treatment would be things like, what are the characteristics of an environment that your child needs to learn? So a highly structured intervention might be better for a child who is struggling to learn in the natural environment because either, it's too much distraction for them, or they don't know which aspects of the environment are the ones they should be learning from. There's a lot of things that can make that challenging, so putting them in a more structured and focused environment can be useful. The flip side of that is a more naturalistic intervention might be appropriate for kids who they are already learning well in the natural environment, and they maybe don't need that high level of structure. And we can really put them into some very constructive learning opportunities through more just developmentally appropriate kinds of, play-based interactions or natural family routines, that kind of thing. A good way to think about this continuum, I think, is also that we always want to move towards the naturalistic because that's more what real life is like. And ABA is actually kind of an umbrella term that encompasses different versions of therapy that sort of fall along that continuum, if you will.
A good ABA program uses a family-centered sort of whole life approach, and it should take into consideration the family's desires and outcomes and resources, and also how much the parents want to be involved in the therapy. So one of the important components of developing this program for your child is that you need to be a very centered role in your child's program. You need to learn how to integrate these goals and how to work on these goals in your natural daily routines. You are the person who is with your child the most, especially at this age, at a young age, and it's important that your child is able to learn and take advantage of these naturally occurring opportunities in your environment. So if you decide that you want to put together a home program, here are the people that you're going to have on your team. One person would be a BCBA, a Board Certified Behavior Analyst, and they are going to be the person who supervises and creates a treatment plan for your child. They will provide training and on ongoing monitoring of progress to home therapy assistants that will work in the home with your child. And you may have 1 to maybe 3 home therapy assistants. And again, they will be supervised by the BCBA. In addition, you're going to have a variety of other providers that the BCBA can work collaboratively with to create goals that are complementary to each other, such as working with a speech-language pathologist or an occupational therapist, as well as your child's school or education placement. And that's really important because the consistency across environments is going to create a stronger skill base for your child.
So there isn't a one-size-fits-all therapeutic intervention, and I think the best intervention programs are really built from the ground up, taking each individual and asking what are the areas that we need to try to focus on, and then building out a plan.
Understanding how to individualize the program to that child's specific needs is probably the first and foremost goal, and also one of the greatest challenges.
To educate kids with autism is really complicated because there are a variety of needs that they have that come really easy to you and I. And so things like, how to enter a conversation, what to do with your hands, when to nod in agreement, how to talk about things that you're not interested in, how to not talk about things that you're really interested in. And all of these social skills are usually learned at a very early age in a very natural way for typically developing children. And for children with autism, that may not be something that they are able to learn in a natural environment. And so piecing apart how exactly to teach these skills and make it look natural is potentially a very challenging component of this whole process. Children with autism frequently don't have the same level of motivation or value in praise or just hearing a good job or a smile from a parent or a teacher. And so we have to augment or support that motivation by adding a little bit extra. So we really have to think about what does this child love? What are they willing to work for to get this particular outcome? And unlike typically developing children, it is a little bit more than I'm proud of you and that makes me really happy, or even just sharing that social moment together.
We have to find a way to motivate them socially. Find a way to make it fun. So we enter their world using toys or objects or activities that they already find enjoyable. And then we bring ourselves into that world, parents or professionals working with them, to pair yourself with the fun activity so that it's the back and forth that's fun. It's you, but it's also because you're doing something fun with them.
People with autism tend to be comparatively better visual learners or have a stronger visual capability. And so we frequently will support their environments with a lot of visual supports or visual cues, such as a daily schedule, and this will help create predictability in their life, but it will also help in understanding and increasing their independence, their ability to independently navigate through their community or their home or their school. Visual schedules aren't the only visual that we use. We use concepts such as a first-then board, where you have first you're going to do this thing and then you're going to do this thing, and frequently the first category is something that's more difficult, and the then is kind of a reward or a special activity that they enjoy, and that helps them sort of break down the expectation. Again, clarify what's expected of them in that environment or what's expected of their behavior, and help motivate them. We also need to focus on teaching children opportunities to cope with things that they don't enjoy, such as, I don't get to play with the train all day long, or I don't get to play with the train in this way, or I don't get it right now because my friend has it. So teaching them also flexibility around those events that they maybe don't like.
Some of the most common hurdles that intervention providers face and that people face when they are trying to make those individualized programs would be things like challenging behaviors.
The difficult part is knowing why that behavior is occurring, because children with autism aren't very good at letting us know exactly what it is that's going on with them that's causing them to act in a certain way. So for example, temper tantrums with young kids can be pretty common. Sometimes that may be because they're overwhelmed by sensory experiences. It could be that they don't understand what's being asked of them. Kids with autism also really like routine and structure, and they oftentimes have difficulty adapting to changes in their environment or transitions.
Those are things that really get in the way of learning. And when we don't have good methodology to reduce those challenges or those problems, sometimes that becomes the sole focus of everything. So I would say that is a big domain that, if it exists, has to really get addressed in order for kids to be able to benefit from interventions in other ways, such as learning communication, improving socialization, play skills, and so on.
In those challenging behaviors and challenging times, it's going to be important for you to really think about what's happening right before the challenging behavior and what happens right after that challenging behavior. Because by gathering that information, what we call in the field as antecedents, or by capturing the information after the behavior, which we call consequences, it helps providers and us as parents figure out how we're going to intervene and make change. And again, you as the expert of your child, none of this can happen without your expert input.
You know, it's very easy in the context of getting a diagnosis of a disorder to focus on all of the problems. And as we think about our interventions, it's no less important to consider all of the strengths that an individual might have.
We always try to encourage parents to see the whole picture, to take a step back and see, what is my child really good at, what comes naturally for them, and encourage people working with them and their parents to take advantage of those strengths and really play to those strengths. And that is going to be different across children.
And it's very important that we not lose sight of those strengths and interests when we're thinking about what to do to help promote someone's development.
So you might find yourself in a situation where you've been doing one or two types of therapy for a while, and you come to the point when you're starting to ask, is this working? Should I keep doing this? Should I try something else? And a lot of times, the best thing you can do is to step back and analyze, is the child gaining new skills? Are they growing? Are they becoming more able? Is this therapy causing him to communicate better, or reach out to the world better, or follow one-step directions better? And are they able to do that with mom, dad, grandpa, sibling, and not just in school, but maybe some of these new skills, if they're translating into home or the community, then we know that therapy is probably making some nice progress. If it's stagnant and we're not seeing a lot of progress, then it might be time to throw things up in the air and reassess what's going on and consider a new approach.
Each person in the family plays a role with your child with autism. My son, my daughter's next up brother, was her best ABA teacher. He did many drills with her, and he was able to engage her better than some of her therapists and her parents. So it's good to help the siblings in the family to better understand autism by involving them and letting them know that they play a big part in helping their brother or sister.
This I can say for my child. She takes a long time to learn, but she does. So you need to be persistent, and you need to trust your child, and don't give up on your child, because they learn. It takes time. Yes, it does.
Freddie is now showing that, he's starting to typically play with toys and show an interest in riding his scooter and, borderline typical things, even though he's definitely still on the spectrum. Mac, I used to just think, we are never going to get anywhere with him. It's going to be always such a struggle. And then I remember taking him in about 2 months ago, and he ran over to a seat, he sat down, he took his shoes off, and then he put them in the cubbyhole. And I just looked at the therapist and I said, how long has he been doing that for? And she said, oh, not that long, but we've been persevering every day for a year. And that's big for Mac.
Said thank you instead of signing thank you, or, showing another way of thank you. If they just said thank you for that time, we celebrate that.
Basically, at the start of the year last year, I thought my son was probably going to be doing kindergarten twice because he's on the young end of the spectrum for age in kindergarten. Through all the help we got and everything, he was able to move on to first grade without any real issues.
I have a hard time, since my son's only 5 right now, seeing what's the toddler and what's the autism, and where do these overlap, or what is just being a boy and the autism. I do have a tough time with that sometimes, but within the window of just a couple of months, so many things change.
Angel, who's my oldest one, started receiving services even before we received a diagnosis, which was very helpful.
The first thing I did when Darren was diagnosed was get him into speech therapy. He did speech therapy twice a week. Then he started occupational therapy once a week. And that was just a start. And looking back at that, I think any little thing did help him.
Some of the things he has developed so well. And it was a journey that was, you could see him, the difference last year and this year. And some of them, we still struggling on it.
So every family has their own financial abilities and challenges. And along the path of the diagnosis, there'll be therapies or recommendations or things you want to do or things you're told to do for your child to bring out the best in him or her. Many times, these therapies are not affordable, they're not covered by insurance, they're not available, there's long wait lists, maybe you don't live in the right area where these resources are. It can be really challenging, really frustrating, and heartbreaking when you know your child needs something or you want to do it for him or her and you can't. In that case, it's complex. You look at the resources that you have, you look at the services that are offered to you, you look at the things you can control and the things that are available for you, and you focus on those.
We're on a waiting list right now for in-home care. We still go to speech, we still go to occupational therapy, we still go to school, we still work on our stuff at home.
Sometimes you feel it's overwhelming and maybe it's not worth it, but it is worth. It is making a difference with your child.
It is a very hopeful place to be when you do see those small changes.
2 years we came a long way.
I don't think there's anything my son can't achieve with the proper amount of help.
Things change and we change. So even if there are still challenges, I'm better able to handle those challenges. And my child has learned skills to cope and to handle those challenges better. And even though you can't predict what all of those challenges might be, having those skills, having those tools in your toolbox will help you for whatever challenges you have in the future.